So just practicing my initial approach to patient assessment. So when I arrive, consider seeing safety, consider doing an ethane report if required. So exact location, type of incidents, hazards on scene, access requirements, number of patients, and extra resources if required, or whether they've turned up. I'll go and find my patient, wear my PPE as required, make sure I've got my mask on, my goggles on, my gloves on. Check out their AFPU, so their responsiveness, or whether alert, hey buddy, Peter from the ambulance service, whether they're responsive straight away, they're only responding to verbal, we have to give them a trap squeeze, pain, or whether they're unconscious. I'll quickly have a quick look and make an assumption on their C-spine, whether they're going to be concerned about their any spinal injuries. And also, if there's any acute bleeding, we'll address that right now. When I put all my kit down, it's got to be in 360-degree access, so if they want to arrest, so I put my bag, oxygen bag here, green bag on the other side, so if we want to drag him out, my patient will be ready to go right there. And we've also got an escape route behind me. So we've got an egress option. And also, then I'll consider whether the patient's going to consent to me if they're conscious. Do you mind if I have a quick look at you? What's going on today? If they talk to me, then I know his airway's patent. I'll get him to open his mouth for me to have a quick look in. So I'll assess his airway. If he's not talking to me, then I might have to position him. Obviously get behind him and have a good look into his airway and see what's going on. Suction if required, use adjuncts if required. Breathing's next. Assess his rate, rhythm and quality of breath. Look for tracheal tug and accessory muscle use. The shirt should be open a little bit. Just have a little listen while he's going, and then I'll coach him. Deep breath in, buddy. And again, listen to 4 spots. Go under the arm. Deep breath in again. Does that hurt? It's not hard? Alright, great. So feeling for any crepitus, or looking for subcutaneous emphysema as well, or any asymmetrical movement with that breath. Provide oxygen therapy if required. If I hear wheezing, could start a nebulizer. But making an action on if I find any issues. Circulation. So circulation, if I find any bleeding, I'm going to have a really good look around. Look at the bottom of them, because gravity pulls the blood down. Right, and I'll address any bleeding if I find any. I'm going to assess his pulse, rate, rhythm, quality. I'm going to feel his skin, whether it's clammy, cold, whether he's hot. Look at that cap refill, even at his toes as well. At that point I can make a transport decision. I can decide whether this guy's stable, unstable, potentially unstable, whether I'm concerned I need to have some backup to help me manage this patient. I can decide on my egress strategy with this guy too. So then I'll move on to my disability and exposure. Disability, get a GCS. Mate, do you know what day it is? So GCS out of 15, eyes 4, mouth 5, body 6. Grab my hand, or here's a torch for you, buddy. He grabs at the torch, top score. Tell me the day of the week. He's responding to me perfectly. I'm gonna have a look at your eyes, look at my nose. Coming from the outside, get whether his eyes or pupils are equal and reactive, whether you're deviated or he's got nystagmus. I'll do a fast test too as part of that. So grip strength, grab my hands, squeeze, push, pull, push against my hands, lift your toes, push down, great. Can you feel this? Can you feel this? Great. Just give us a big smile. I'm fabulous. I'm not concerned about a stroke, an acute stroke. Exposure, E. So obviously take their clothes off to have a look at what the heck's going on, cut their pants off within reason. You know, I'm considering the environment and their modesty. And do a full nose to toes very briefly. And address any concerns that I find, any break fractures, any rashes, any any bruising concerns. Then I'll do my vitals. Get my partner to do a set of vitals, rest rate, pulse rate, BGL, temperature please, ECG if required. Something else, temperature, rest rate, pulse rate, SpO2, so it gets oxygen sats, which probably would have been on straight away, and then do my sample history, signs, symptoms, write it down. Allergies, buddy, take medications. You've had this before, past medical concerns. What's your last meal, and what actually happened leading up to? How did you get to this point where you're feeling well today? And then I would probably, that's the end of my thingy do.